Yes, today, listeners, I'm excited again to be able to talk to you about a topic that you have asked me to talk about, a very important topic indeed. It's a matter that is affecting over 50% of adult males, those who are 40 years and above. But on scrutiny, it affects women as well, because it is like a game. Men can't play alone, they must play with ladies. And if they are affected, then the ladies also be affected. And this is none other than a topic, erectile dysfunction. Today I want to show you that it is possible to live without erectile dysfunction into your extreme age, 60, 70, 80, even 90s, when you are still active sexually. We want to discuss how to prevent and reverse erectile dysfunction. But before I go deep into the subject, let me introduce myself to you, especially to those who are new to our video series. My name is Dr. Mpora, medical doctor from Enlympo Health Services. Yeah, before I go further, let me explain to you some physiological principles so that you can be able to appreciate the information that we'll discuss later. First, the penis is an extension of our circulatory system. It is an appendage, just like the heart. And an erection to occur means that the penis has become firm, it has got engorged, and it has enlarged. And this is a complex process of sexual response, and it involves nerves and blood vessels of the penis, plus a number of hormones. But an erection starts from with a sexual response, or a sexual arousal in the brain, where the brain sends information or signals to stimulate the penis. And this process is facilitated by two main hormones, namely nitric oxide and testosterone. These hormones act as vasodilators of the blood vessels of the penis. They allow blood to flood the penis, as it were, and cause an erection. Testosterone is produced by your testes, and nitric oxide is produced largely by the endothelial tissues of your blood vessels, in this case of the penis, and its production requires use of an enzyme called nitric oxide synthetase, and this enzyme is facilitated by testosterone. So testosterone is required for this enzyme to function properly, so that you produce nitric oxide or sufficient amounts of nitric oxide. So what is erectile dysfunction? Also known as impotence, erectile dysfunction is an inability to attain and or maintain an erection sufficient enough for satisfactory sexual function or sexual performance. It is actually a reflection of poor circulatory health, a result of poor vascular dilatation and narrowing of the blood vessels of the penis, which results in restriction of blood flow to the penis, which then that blood flow cannot flood the penis in order for it to become firm, enlarged, and engorged, which we have said is the definition of an erection. What then causes this poor dilatation and narrowing of blood vessels in the penis? There are a number of factors that do this, but for clarity and ease of comprehension, we have grouped them into two, both physical and psychogenic causes. Of the physical causes, the first one is poor or insufficient availability of nitric oxide. As we've said, nitric oxide is a modulator of dilatation and produced from the endothelial tissue of the blood vessels, in this case of the penis. One of the causes of this hormone being insufficient is damage to this endothelial tissue, so that is low production. And the major culprit in the damage of the endothelial tissue is poor metabolic health, what we call metabolic syndrome, and the root cause of which is insulin resistance. As a matter of fact, all the 5 components of metabolic syndrome, like high blood pressure, high blood sugar, body fat, especially around your waist, increased cholesterol, especially low density cholesterol, and increased triglycerides, they all contribute to damage of the endothelial tissues. Now, a second cause of low product or availability of nitric oxide, obviously, is dietary deficiencies, because nitric oxide is produced from some substrate from our food, where amino acids like citrulline and arginine are required. And if you are low in the supply of this in your food, you'll have low production. We have said also that testosterone is required in facilitating the hormone that produces nitric oxide. If for some reasons you have low levels of testosterone, then you will not be having enough nitric oxide. And things that can cause this include gonadal dysfunction, nutritional deficiencies, because even testosterone is made from food substrates, toxins and heavy metals in your system, alcohol use, and then high levels of stress, where the stress hormones like cortisol and epinephrine also contribute to low production of nitric oxide, of testosterone, and therefore low levels of nitric oxide. Yeah, another component of the physical causes is poor blood supply to the penis. And one of such causes is poor physical inactivity. That is physical inactivity, lack of exercise. Because exercise can increase strength of the pelvic muscles, which cause pressure on the vessels to the penis, and therefore increase blood supply. Another one is smoking. If we smoke heavily, then we cause narrowing of our blood vessels, and therefore reduce blood supply to the penis. And if we use drugs like for hypertension, for prostate, or for antidepressants or psychotic drugs, they also cause reduction in blood supply in our vessels, including the penis. Another one is penile anatomical abnormalities, like if you have a fractured penis, or a disease called Peyronie disease, you have limited blood supply to the penis. And if surgery and trauma has caused damage to vessels, for example, surgery to the penis or surgery in the pelvis, like in a radical hysterectomy or prostatectomy, damage to the vessels, the penis can occur, and this will also reduce blood supply to the penis. Now let's discuss psychogenic causes. These are issues to do with the mind. They interfere with in nerve signaling from the brain to the penis to be able to be excited and get an erection, even if the endothelial tissues are intact. And psychogenic causes account for about 40% of the causes of erectile dysfunction. They include things like stress, anxiety, and depression of any kind, and they could be sexual related. For example, performance anxiety, or relationship problems, or sexual guilt, or could be socioeconomic when you have low income, or you have professional stresses, or could be fatigue when you are tired, or they could be neurogenic. For example, there has been surgery that has caused trauma, or even you have spinal injuries from accidents, and the pelvic nerves are destroyed, or you have neuropathies from certain diseases like diabetes or peripheral neuropathy. All of these now interfere with signaling of nerves, information from the brain to the penis to be able to get an erection. Now that we've discussed or understood the causes of erectile dysfunction, we can now discuss how to prevent or reverse erectile dysfunction. The first way is to improve endothelial function. We've said that the hormone that is very responsible for this is produced from the endothelial tissue of our vessels. So we need to improve the function of that endothelial tissues by improving our metabolic health, whereby we can reduce insulin resistance that is chiefly causing the damage to our endothelial tissue. And we have a video on how to reduce or reverse insulin resistance. You can find the details of this on our website, www.enlympo.com. Another way is to enhance availability of nitric oxide and testosterone from our diet by improving our diet, because as we said that we need substrates in our diet from which these hormones are made. For example, eating beetroots, garlic, leafy greens, poultry, fish oil, olive oil, all that kind of stuff in our diet. Or we can even supplement if it's difficult to get them in our diet with these things, plus vitamin C, vitamin D, vitamin B, coenzyme Q. All these have been found to be useful. The other one is to reduce alcohol use or even stop use of tobacco. Another one is to have psychotherapy, and we have a whole program on how to practice psychotherapy on our website. Another one is to do rehabilitative procedures for the injuries on our nerves and blood vessels if we had surgery or accident. And lastly, but not the least, we can carry out a detox program to rid ourselves of toxins and heavy metals. And we have another full program on detox on our detox blog on our website, which you can access and empower yourself with this knowledge. So listeners, in conclusion, for more details or more practical information about prevention or reversing ED, you can check on our website, www.enlympo.com, or subscribe to our health newsletter, or check out our detailed blog on this matter, or contact us on our telephone numbers and emails that are displayed here below, or chat with us on our WhatsApp, or keep in touch with us on our social media handles, our Twitter, our Facebook, our YouTube, and our TikTok. But don't forget that we are leaders in providing quality food supplements, so you can contact us even for delivery at your doorsteps. So let us now meet in our next video.